My name is Dr. Rick Saguil.
And action. Hey, Jay, this is Kirk again. And action. Hey everyone, Lynn had a question about what to do with facial hair when it comes to the N95 mask or just this COVID crisis. If this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button, wherever that is, to find out when I do new videos. So, facial hair and droplet spread. So far, the CDC has not recommended that you have to shave for COVID. However, there are some rules way back in 2017 with regards to OSHA and mask use. And pretty cool. You can look this up on your own, but here is the suggestion from 2017. And what I found, what was really cool, was, I mean, there's a villain mustache. So these are all the different types of facial hairs, or the patterns that people wear. And there's either checks for types of mustaches and beards that you can wear with a respirator, and one of them is a toothbrush. It looks like a Hitler mustache. And there are X's under the different types of facial hair that you're not supposed to wear while have while wearing a respirator. And one of them is Fu Manchu, a couple others. Pretty cool. I didn't know that there was actually classification for this stuff. So it's important to consider that, not necessarily for Corona, but I'm going to explain my argument for Lynn, and the idea would be, are we doing the best we can to prevent inhaling and spreading? And in the case of spreading, I think that it has been proved by the CDC that everyone in the public, aside from keeping that 6-foot distance, social distancing, should wear a cover of some sort. And this is a standard mask. It has holes on the side, if you can see that. Even if I put this around, there's still areas that will leak underneath and around the side, if in case I walk into a cloud of droplet. And a mask has stated by the Surgeon General, you can make your own mask. In fact, there's a pretty cool, I'll put a link down below, there's a pretty cool video that the Surgeon General did on how to use napkins properly and make your own mask of sorts. That's essentially to stop the spread. I think that's what the CDC is trying to suggest, which makes sense, because if you check out the Japanese, this is a Japanese video. And they were trying to figure out how aggressive to get and if it was worth it to keep the social distancing. And I'll play it now, and I'll put a link down below too. But this is a guy that's about to sneeze, and there's the droplet spread after the sneeze. And using lasers, they were able to find, this is just a reenactment about how droplets spread will spread in a closed environment like a room. Pretty ingenious. Again, I'm not sure if this is a peer-reviewed idea or study, but it just showed that when you sneeze, and then they went on further to do, if you're just talking, about how droplet spreads, especially with loud, what they call loud talking, how sneezing will send off a bunch of droplets, and the heavy ones will fall down, but the other ones that are lighter will linger on. And I did do a video about essentially comparing a fart to aerosolized particles. So I'll put a link down below. That's 3 links I'll put down. So, but the interesting thing out of this is that in a room, the reenactment that they came up with the data they have, was that just with one person coughs or sneezes without using a mask, it can linger in a closed container to essentially give the same viral load to everyone else in that small container or a small room. So then the question beckons, how much of a viral load would be pathologic to inoculate the next person? So if you have an index person and I sneeze, or I talk out loud like I'm giving a lecture, and I'm spreading the viral particle, how much is necessary? And also, how long does it take between being asymptomatic and being infected to being symptomatic, because we know at least that, and here's a study that was in the New England Journal of Medicine, and they evaluated the nasal carriage and the throat carriage for people as they went through the course of the infection. And again, here's the, you can look it up, I'll do this up here for a while. So they were examining the viral load in the nose and throat. They swabbed people. I didn't read all the details, but essentially they found the bottom line, and again, I could be cherry picking, but it's to present an argument for Lynn. They found that in symptomatic people with colds, coughs, fevers, and really feeling lousy, body aches, typical for the beginning of coronavirus, symptomatic patients would spread and carry. They would carry a certain viral load in the nose and throat. And goes without saying, if somebody's coughing in front of you, stay away from the blast area because you figure that something's going to come out. But the study compared people when they were asymptomatic and found that even the asymptomatic, that means no symptoms, and there's a prodrome that occurs before the symptoms actually occur, which is why this virus is really intelligent. But people with that just getting exposed, between getting exposed from another index person and then having the symptoms, they had the same amount of viral load in the nose and throat. So let me repeat that. People that did not have any symptoms but were contaminated, and people that were symptomatic and obviously contaminated, the same viral load existed in both cases, both types of people. That means that if you're talking to somebody, or if somebody sneezes that's doing fine, not even a fever, that they will have the same amount of viral particle in the normal, in an innocent allergy sneeze, or in a normal loud conversation, I guess, has a person that's shedding the virus actively. And that's where the brilliance of this virus comes in, and it's damn brilliant, but we're better than that. So the objective is to figure out if using the N95 mask will help. So this is an N95 mask. I just showed you my other mask. The N95 mask fits and has a seal around it like this, all around. So if used properly, there shouldn't be any inhalation of viral particle or external environment. This is also an N95 mask. It's shaped a little bit differently, but you can see that it does fit. If you open this up and put it around your head, it does fit. Creates a pretty, this is small for me, and just to explain how this, even if you have an N95 mask, it might not fit properly. So you can see that it should seal properly if worn well, but this is a small. So in OSHA, or before we work for occupational medicine, there's a way to test using a taste and smell test. You put this big helmet on, and you breathe just for a second, and somebody squirts something while you're wearing a mask. Somebody squirts something into the helmet, and you're not supposed to, if the mask is sealed properly, you're not supposed to, in this closed environment, not supposed to taste or smell it. If you do taste or smell it while wearing the mask in this big, almost like a diving bell, that means the seal is not proper. And in cases of noxious or gas, especially dangerous gas, it's dangerous. So this is a typical example of one of those what environmental hazard agents are protected with. So if you look at the seal here, the way this works, hopefully you'll be able to hear me. The way this works is that with the proper seal, every time I take an inhale, I inhale through here, these two things, and I exhale through here. So hopefully you saw what happened. So there's a way in and a way out. And these filters are supposed to filter particulate matter down to, I think it's 0.1 microns, if I'm not mistaken. Oh, and again, I did it on my other video. But that's the proper seal, but it's just too cumbersome to wear this. And in a hospital would probably scare patients, I believe. But you know what? If it's my life, let the patients get scared. I think that's one of the, I've heard that's one of the problems or the arguments for some hospital systems saying, don't wear this because it'll scare patients. If I'm going to the hospital to take care of people and I'm at risk for dying, I'm going to wear anything I want. If they want to fire me, fire me. But so then the question comes, can you wear this or this with facial hair? So the problem with, and as I showed you on the sheet, the problem with certain facial hairs is if the facial hair, like say this is a mustache, and I put this on, I just broke my seal here. So around where the hair protrudes from the edge of the mask, you have just a tiny, tiny bit of opening. And if you have a tiny bit of opening, and say it's serine gas, you don't want to have the serine gas leak through that tiny bit, because all you need is one droplet and you're dead, so to speak. Now, in the case of COVID, where you are taking a chance, thus far we don't know, the data isn't there to say how bad is it and how much of a viral load is necessary to cause a problem. And then if you do get the virus, who dies, who doesn't? We don't have enough data. We will probably in a year before the next one comes around, after it's morphed in the southern hemisphere, so this isn't going away fast. However, if you have a little bit of a leak, it's dangerous. So if you're going to invest in one of these things, you probably should shave. My bottom line, Lynn, is that you probably should have your loved one shave, especially if we're in high risk. Or if I have a patient that has, say, there was one called a villain. One of the mustaches is called a villain. Check out the thing. And the villain, it can protrude out. And the problem would be if it protrudes out and you have an immunocompromised patient. That could be HIV. That could be autoimmune disease like rheumatoid arthritis. That could be diabetes. That could be hypertension. All those things decrease your immunity and make it harder for you to fight. Or just plain old obesity. So that's what this data shows out of New York, is that there seems to be a relationship. So if you have any of those symptoms and you have the wrong type of facial hair, shave it or trim it, because you won't have the proper seal if you have this thing. If you don't have that and you're just relying on this, the question would be whether using just this and having facial hair would increase your chances of the viral load inhalation. Unfortunately, nobody knows. But in that case, where you can argue that you don't want to shave the facial hair or trim it, the other thing to consider too is that facial hair, especially if it's a full beard, it can hold particle. So as far as how long it'll hold a particle, again, the studies are there as far as fomite length of survival for the virus, but the other problem is we can always don masks and gloves, and we take them off in sterile technique. But what do you do with facial hair? I mean, guys usually wash their hair on a routine basis, more so than women, because of the difficulty with long hair being slower to dry. However, do you actually shampoo and wash your beard and mustache like you would wash your hands? I don't. That seems too cumbersome to me. I don't know the answer to that. I guess it depends on how often people with facial hair shampoo or wash or soap and water their beards, or if they can even do that. So, hey, comments down below on if you have facial hair, how often do you usually wash it? Is it a daily thing? Do you do it when you brush your teeth? You also do soap and water? And then the question is, if you have a full thickness beard, for example, or a big handlebar mustache, how much is necessary and how many minutes is necessary? We know that 20 seconds is important for hand washing. How much do we have to do for facial hair? Especially if you go and kiss other people, which probably shouldn't be doing, but in a household where you might have been exposed and inhale, or exposed and on the face, how long will it exist? I don't know. But I think in the long run, if we're talking about protecting from exposure, the tighter the seal, the less the likelihood, in theory. So if with regards to this, or using one of those masks, if in case you run into a cloud of COVID that somebody else just coughed in. Again, that could exist in the atmosphere with the lighter droplets for a while. As far as how long a while is, I don't know. If you're outdoors and hiking, the likelihood is very, very low that you'll walk behind somebody else's fart. I mean, somebody else's cough or sneeze, and then inhale a significant amount of bacteria or virus. As far as wearing one of these, if you're a healthcare worker, I would, in Advocate, they have suggested shaving the facial hair. So I think that also depends on your corporation or who you work for as far as the rules. But at this point in time, it's plus minus. If it were me, I would say shave it, especially if it gets to the part where we're finding that this disease or this infection really has a high kill rate. If it's outdoors, I'll leave it up to you. I mean, we're going to be going through this for at least, I think, 2 to 3 more months. And then in the end of the summer, fall, and then winter next year, hopefully it doesn't come around again and mutate too much, but it's going to be an ongoing problem. So hopefully this gives you an idea. Put your comments down below, anybody that's watching this, or share this with anybody with facial hair.